My next guest is a practicing emergency room physician, former health commissioner of Baltimore, and a professor of health policy and management at George Washington University. She's also author of a recent book, and I've read this book. I really recommend everyone read this book, Lifelines, A Doctor's Journey in the Fight for Public Health. Dr. Leana Wen, thank you so much for joining us. I just want to start out with the news. I mean, where are we with children and COVID? You know, you've been writing about, the different phases of how our society needs to take health seriously, health guidelines seriously. What are the health guidelines as you see it regarding children right now?
Well, I think there is one pervasive and false narrative that we really have to counter, which is that children somehow do not get sick from COVID-19. That's just not true. I mean, when we look at this group of kids that we're now getting the vaccines authorized for, this group that's 5 to 11 years old, there have been more than 1.9 million cases of COVID infections in this group. More than 8,600 of these younger kids have been hospitalized. Thousands have had this multi-system inflammatory syndrome in children. And by the way, about a third of the kids who've been hospitalized are children who are previously healthy, who don't have underlying medical conditions. And tragically, 143 of these younger kids have died. And so I think it's really fantastic news that we could have a vaccine for this younger group on the horizon. I can tell you, as a mom of 2 little kids, although my little kids are too young to be in this 5 to 11-year-old group, I have a 1-year-old and a 4-year-old, my husband and I are living with a lot of caution because we're worried about our children. And we really cannot wait until our kids are also able to be vaccinated so that we parents and certainly children can regain some sense of normalcy too.
Well, look, I just want to underscore what Dr. Wen just shared, and Dr. Wen in her Twitter feed did share these statistics, and among them, the most sobering was that 143 5 to 11-year-olds have actually died. And I can't tell you the number of times I have heard in the hallways from people, even from informed experts, oh, children are not vulnerable. But that's absolutely not true, and you can see it in these numbers. But let me just kind of go a step further as we sort of talk about this moment we're in, which is not over, but how we use this moment to reestablish our connection to smarter public health. You and I talked at the beginning of this pandemic and said we have not been smart about that scaffolding of public health. What do you think we're doing? What do you think we're not yet taking seriously enough?
Steve, I am really worried about where we are when it comes to public health. Prior to COVID-19, I thought that the biggest challenge we would have is to get people to recognize the importance of prevention, the importance of having local and state public health infrastructure and the work that we do all the time around the opioid epidemic, around other infectious diseases, around caring for our most vulnerable. But unfortunately, during COVID, we have seen public health becoming politicized and basic measures like masking or vaccines or testing being put into the middle of ideological culture wars. The New York Times just did an analysis that found that there have been more than 100 laws that have been passed in state legislatures to directly restrict public health authority. That doesn't just affect COVID. That means that in the future, if there is a case of multi-drug resistant tuberculosis, a local health authority may no longer be able to apply quarantine. And that means that if we have another virus that requires masking, maybe in the future, masks are not going to be worn just because people really are objecting to it for some ideological reason. And so I actually think that we are less prepared for the next pandemic. I actually think our public health infrastructure is decimated even more than it was before we started COVID. And whereas public health was the sleepy backwaters that people didn't think about before, now a good portion of this country think about it in a really negative light. And I am not certain how we're going to get it back to rebuild, but also to even get back to where we were at the beginning of this pandemic.
Leana, I want to ask you a personal question. As we think about a more perfect union, I want to tell people, I've read your story. You and your parents were immigrants to this country. You came here under very tough circumstances, very little money in your dad's pocket. And I think lived experience and sharing it can be very powerful. And I would love our audience to know a little bit, a snapshot of how your lived experience made you choose public health as an avocation and a lifetime commitment.
Well, I appreciate your asking this, Steve, and I enjoyed our conversation before about Lifelines, the book that I published that wasn't meant to be a memoir. It was actually meant to be a celebration of public health, and especially the work that we did in Baltimore, but ended up becoming about, in part, my life story, because in a sense, it also illustrates what public health can do. So my parents and I immigrated to the U.S. from China just before I turned 8. And my parents, despite working multiple jobs, my father delivered newspapers, my mother cleaned hotel rooms while she was studying to be a teacher, we still had trouble making ends meet. And there were times when we experienced homelessness. We depended on food stamps. I went to public school throughout. We depended on Medicaid and Children's Health Insurance Program. And for us, those social safety net programs, they were not some kind of entitlement. My parents always made it clear that this is what we needed to do for the time being in order to get our footing. And as a result, my little sister and I have been able to fulfill our own wildest dreams, and I've been able to become a doctor, to be able to serve the communities of individuals that in the places that I came from. And I guess I understand so much of public health as being something that can level the playing field of inequality. Because in my city here in Baltimore, for example, we have kids that are born in one neighborhood whose life expectancy is 85 years. But just a few miles away, another child born today can expect to live just 65 years. And it's these social determinants of health that are not just about the health care that you receive. It's also about the educational opportunities you have access to. It's also about the other conditions in your life and the food and the other resources that you have. And so public health can help to level that playing field so that the opposite of health, or so that our children do not have to grow up in a world where they have to experience poor health.
You know, one of the things I really admired about you both during the early start of COVID and during the Trump administration, but also during the Biden administration, is, to the best of my knowledge, you're very apolitical when you talk about these issues. You applauded some things Trump did. You really condemned and criticized some things. And you've been on both sides. I remember when you said, 100 million people in 100 days is not enough, not big enough. This is easily doable. Why? I mean, so you've written critiques in your newsletter in the Washington Post of why this administration's ambition and horizon on these issues should be higher. I'd love to know, in your sober way, what should those policymakers in this town be thinking of right now? What should the Biden administration be doing that it's not doing?
Well, I appreciate the question, and I think that I'm going to reflect on something that Dr. Boris Lushniak, now the Dean of the University of Maryland School of Public Health and former acting Surgeon General, likes to say, which is that we in public health should aim to be political, but not partisan. As in, we have to understand politics, because doing policy work and working in the sphere where many public health officials are appointees of mayors and governors and other elected leaders, we have to understand how to navigate politics. And so actually one of my critiques of the Biden administration is that they keep on saying, follow the science, when actually the questions that are often there are not just about science. Yes, of course, science is important. Yes, of course, we need to follow the evidence. But for example, in the conversation about boosters, we've seen that you can have the exact same set of data, but different people will interpret it in different ways. And actually, so much of public health is also about values. And the decision at the end of the day should be made by our top elected officials in consultation with scientists, making sure that we are following the science. But that concept of follow the science has been distorted, I think, in the Biden administration to mean only listening to certain scientific agencies at the expense of having a broader stakeholder engagement. And then as a result, you violate one of the core tenets of public health, which is that public health depends on public trust. If you cannot win over hearts and minds, you have lost the day. Just having perfect science is not enough. But to your broader question, though, about what more can be done, I think very practically, the one thing that I would love to see the Biden administration do is to scale up testing. We need to get to the point that other countries have gotten to, which is UK, for example, has rapid tests available to everyone who wants them. They'll distribute them free to all families twice a week if they want to. There are other countries too, Singapore, Japan, making testing ubiquitous in vending machines. Many other countries, it's the norm to get tested right before you go to a friend's party or a potluck, because that's something that's important to do as we learn to live with COVID. I think the Biden team has done an outstanding job when it comes to vaccine distribution. I would like for them to apply that same level of urgency and the mechanisms, their operational expertise when it comes to making testing available. Ultimately, at the end of the day, though, we in public health have to continue, I believe, to understand the politics and policies, but make sure that we are not partisan in the work that we do.
Thank you. So powerful. Finally, is trick-or-treating? Trick-or-treating, so you're wearing Halloween orange. Is it too early, or do you think it's safe enough?
Well, I plan on going trick-or-treating this weekend. My 4-year-old is really excited about going, especially because we couldn't go last year.
What's your 4-year-old's character?
And so he is going to be Winnie the Pooh. He's dressing his little sister up as Piglet, being outdoors, trick-or-treating, going to outdoor scavenger hunts. We're having a bonfire, an outdoor movie night. All those are really safe things to do. I would avoid indoor gatherings when there are unvaccinated children for the time being. But I think this is a very different year compared to last year because of vaccines and because we know so much better about how we can best protect ourselves and our loved ones.
I wish I had been Winnie the Pooh as a child. I went as Captain Nemo, and maybe that's the problem. But listen, thank you so much, Dr. Leana Wen, former Health Commissioner of Baltimore, Professor of Health Policy and Management at George Washington University, and author, of course, of a book that I just think is so powerful, Lifelines, A Doctor's Journey in the Fight for Public Health. Thank you for joining us.
Thank you, Steve.